Welcome back. We're going to cross to SABC News journalist Gillian Pillay. Now, this relates to a story that we've been covering quite extensively here on Morning Live, and Leanne especially has been at the story, and it is the story that involves aggrieved Black and Indian healthcare practitioners who are today marching to Discovery Medical Aid Scheme to hand over a memorandum. Now, the aggrieved doctors, they call themselves Solutionist Thinkers of South Africa, and they say that they are discriminated against by medical aid schemes due to their race. And one of the biggest struggles is, of course, alleged receiving payment from medical aid schemes. They also state that they are subjected to unfair audits, and because of the prejudice from medical aids, many Black and Indian healthcare practitioners have taken their own lives due to mounting financial constraints. So we're going to cross now to Gillian, where that march will be taking place later on this morning. Gillian is in Sandton. Gillian, good morning. Please tell us exactly what's happening at the moment.
Very good morning to you, Sakina. Yes, the past 3 weeks, those lives that we had on Morning Live with the various practitioners, we even saw Health Minister Aaron Motsoaledi coming into studio there, as well as Discovery giving right of reply there to some of the allegations that were made by the aggrieved healthcare practitioners. The culmination of that really seeing this march taking place. We expect the march to take place around about 10 o'clock today. Sakina, they're going to gather here at George Lee Park, and from there they're going to take a 2-kilometer walk to the Discovery building, where we expect the practitioners to hand over a memorandum of grievances to Discovery. Well, it's a range of groups that will be joining this march, one of them being Solutionist Thinkers of South Africa, Sakina, but also very interestingly, flanking these healthcare workers are members of Discovery who, have also been affected by this. I'm joined by Sibusiso Sitoli, who is with FRET. Basically, I'm really, representing people like you and I, patients who go to the various practitioners. Why is it important that you support these aggrieved practitioners in this particular bid to hand over the memorandum today, Sibusiso?
The thing is, when you have a doctor, you create a relationship. You cannot have a situation where a doctor gets suspended and medical aid tells you that you cannot go and see your doctor anymore. That is a problem. Medical aid or Discovery needs to understand that they actually are accountable to us as members. They cannot make demands and changes without consulting us. These are our doctors. They have no right to tell us where to go, and they have no right to just suspend our doctors without making proper informing us properly.
What are you hoping, you participating in this, what are you hoping it will bring about, Sibusiso?
One, it should raise awareness to everyone that this is what medical schemes are doing. Two, we are telling the medical aid, as FRET and Imbumba Business Forum, we are saying to the medical aid, you cannot tell us what to do. You should stop robbing doctors, stop robbing us of the right to choose. Consumer Protection Act it gives us a right to choose who we go to, where we spend our money, how we're doing it. So medical aid cannot tell us what we're supposed to be doing with our own monies.
So you're saying patients have really been affected by being told which practitioners they can and can't see, and also patients having to pay out of their pocket, and in some instances not being reimbursed for that kind of consultation?
Discovery doesn't reimburse patients because after they've said that a doctor cannot see patients from Discovery, now they do not acknowledge the receipt that you get from that doctor. Another important matter, Discovery cannot ask medical practitioners to give private information about patients consultation. That is illegal. It is not right.
Sakina, we're also joined by one of the first people who were on Morning Live when we broke the story with Dr. Gumede, Donald Gumede. We're joined by Noma Efesi Gacheni, who has been spearheading this particular row between practitioners as well as medical aid schemes. How do you think this particular march is going to change things, if it is even going to?
This march, I believe strongly, Gillian, that it will change a lot of things, because at the moment we are sitting with a situation that Discover is still dishing out illegal audits to all the practitioners. Discovery is still failing to acknowledge that they have done mistakes by racial profiling our health practitioners. Discovery is just disrespectful on anything that had been said, whether in media or anywhere else. So we believe that with this march, we want to show Discovery, even though we try to engage relevant stakeholders to engage them, they are still bullying us. They are still calling our colleagues to come and account for illegal audits. So we hope this march will end this.
What types of grievances, just highlighting a few, will you put forward to them?
We want we want our practices to be opened with immediate effect. Discovery need to inform the patients that those letters that they send to close our practices, they will reinstate us as from today. They will stop bullying us by calling us into audits. They will stop keeping our monies and not releasing them, because as I'm talking now, most of our colleagues are sick. Our colleagues are taking antidepressants because they can't cope. Our colleagues cannot afford anything. Their houses had been taken. They've lost their cars. So we want this to stop by the end of today.
How do you think the commission of inquiry that was launched about a week and a half ago or 2 weeks ago by the Council of Medical Schemes, how do you think that will bring about change, or will it? What is your views on that commission of inquiry?
The commission of inquiry that had been started, we don't have 100% hope on it, because there were parties that had been engaging the minister, there were parties that had been engaging the commission of inquiry, especially CMS, but nothing had been done. The past 4 years, we are still sitting with the same problem, even though many people had been fighting this. So we don't have hope on that. And currently, we are sitting with a situation that we cannot see patients. Patients are dying right in front of us, and we are unable to help them. Hence, we are enforcing that today, Discovery is going to act with immediate effect.
That was Noma Efesi Gacheni from Solutionist Thinkers, one of the groups that will be marching to Discovery from 10 o'clock this morning, Sakina. We're seeing a few of them trickling in now, but we're expecting something like 2,000 we expect to march to Discovery. We link to an ad break now.